Number one, it is one of the most common conditions in the world right now and rising. Number two, is one of the most progressive disease processes in the world, leading to neuropathy and potential amputations. And number three, my grandmother actually suffered from diabetes and neuropathy, and it was incredibly difficult for me to watch her go through that because she had asked me for help earlier on in my career, and I was not yet knowledgeable enough in the subject to really help her. So when I learned how to combat diabetes and neuropathy, it became a focal point in my office. And number four, it is one of the most simple corrections of any conditions that I talk about. And so what's the simple correction? Keto. But before I go into why and how it works, like almost every other condition I talk about, there's one step you want to do first. Can you guess what it is? It was in my last video. You guessed it, we have to fix the leaky gut and get rid of the inflammation present in the body. But once that is done, let's go over why keto is one of the best ways to reverse complications of diabetes in both type 1 and type 2 patients. In type 1 diabetics, they can't create or release insulin into the body, and in type 2 diabetics, they do create and release insulin, but the insulin doesn't work very well. Insulin is released when we consume carbohydrates and effectively allows cells to absorb glucose to be used for energy. Problem for diabetics is that in either case, insulin either isn't released or doesn't work. So blood sugar gets high, and when they eat carbohydrates, they can cause a world of problems. Again, one such risk is neuropathy. Another is Alzheimer's, such as sometimes known as type 3 diabetes. There's also syndrome X, which is very closely related to insulin resistance, and I'll have that video, that'll be in a separate video. With keto diet, carbohydrates aren't consumed, so insulin isn't released. Instead, the body uses fats and proteins as an energy source. The reason we need to eliminate carbs is because they are normally very easy for our body to break down and will be the first thing the body uses for energy. Only by eliminating it will the body resort to other forms of energy that are actually inherently better because our body doesn't build up an intolerance to it like insulin does. So when we eliminate carbohydrates, instead of releasing insulin, it will release another hormone known as glucagon. This hormone breaks down fats for energy, which are much higher in source of energy than carbohydrates. Though the body can survive very well on glucagon for fuel, there is one part of the body that doesn't, and that's the brain. Instead, the brain uses ketones or ketone bodies when carbohydrates are absent, hence the name keto. Ketosis refers to a state in which the body is breaking down fats to create ketones, which are used for energy by the brain. It is one of the healthiest ways to live, but it can be very difficult for some. For diabetics, though, it is an absolute must if you want to reverse your diabetes. And yes, I did say reverse. Maybe not for type 1s, because no matter what, your body will never create insulin, but you can absolutely optimize your health with keto. Type 2, though, can be reversed.